Dr. Mark Di Pasquale here, and this presentation is for those who want to improve their cardiovascular or heart health. So you can listen along, um, watch the accompanying slides as I take you through how pycnogenol improves endothelial or blood vessel function, how it stimulates blood vessel relaxation, how it improves blood vessel dilation, how it reduces blood pressure, how it inhibits platelet aggregation and thrombosis, how it improves blood lipids, meaning cholesterol. And I will end with a full reference list, and you can also download this document if you like. I'll have the link in the descriptions. So keeping the cardiovascular system healthy is key for maintaining good vitality, physical strength, mental health, and for general well-being. Vascular function may be at risk because of only a few factors beyond our control, such as gender and the normal aging processes. In contrast, there are numerous variable risk factors such as cigarette smoking, obesity, sedentary lifestyle, and the stealth risk factors hypertension, hypercholesterolemia, and hypoglycemia. Pycnogenol as part of a healthier lifestyle may significantly contribute to the improvement of stealth heart health risk factors owing to the normalization of blood pressure and platelet function, improvement of blood lipids as well as blood sugar values. And an ever-increasing number of clinical studies demonstrate the efficacy of pycnogenol for keeping cardiovascular health problems at bay. Pycnogenol was investigated in healthy people, individuals with borderline high risk factors, but also as an adjunct in people taking prescription medicine for cardiovascular health issues. Pycnogenol improves endothelial function. The common denominator of most cardiovascular risk factors is the inability of a blood vessel to generate the most important vascular mediator, nitric oxide. Nitric oxide is synthesized by endothelial cells, which line the interior wall of blood vessels. Nitric oxide molecules diffuse through the blood vessel wall to finally interact with a specific receptor in smooth muscle enveloping the vessel. This causes the muscle to relax, and in turn, the vessel lumen increases. This self-regulation mechanism allows for relieving insufficient tissue perfusion and pressure buildup in blood vessels. Furthermore, nitric oxide also acts on blood platelets to decrease their tendency to form aggregates, which translates to a protection from developing thrombosis. In various clinical situations such as hypertension, atherosclerosis, and diabetes, but also with increasing age, the endothelial synthesis of nitric oxide declines. This results in chronic blood vessel constriction, which impairs blood flow, elevates blood pressure, and increases the risk of thrombosis. Pycnogenol activates the enzyme endothelial nitric oxide synthase present in endothelial cells to more efficiently generate nitric oxide from the precursor amino acid L-arginine. Human pharmacological trials show that pycnogenol enhances endothelial function. The effect of pycnogenol on endothelium-dependent vasodilation and blood flow was investigated in a pharmacological investigation with 16 young healthy volunteers in a double-blind, placebo-controlled fashion. Endothelium-dependent forearm artery dilatation and corresponding blood flow increase was initiated by infusion of increasing amounts of neurotransmitter acetylcholine, which stimulates activity of nitric oxide enzyme to enhance generation of nitric oxide. After 2 weeks supplementation with pycnogenol, the endothelium could generate significantly more nitric oxide to increase forearm blood flow by up to 46% higher than at baseline. This effect of pycnogenol was significant as compared to placebo, which did not increase the forearm blood flow. Further controlled experiments using L-arginine antagonists provided that pycnogenol did indeed enhance vasodilation by stimulation of endothelial nitric oxide synthesis function. The result of this pharmacologic study is impressive because it demonstrates enhanced endothelial function response in healthy individuals. Thus, even healthy people will benefit from supplementing with pycnogenol, resulting in better blood flow and tissue perfusion. Pycnogenol improves endothelial function in cardiovascular patients. A double-blind, placebo-controlled crossover study with coronary artery disease patients showed that pycnogenol significantly improved endothelial function, whereas no effect was found with placebo. These patients were under excellent control with medications for blood pressure, platelet function, and blood lipids. Patients had blood pressure 120/75, which did not change during treatment. However, endothelial function improved as pycnogenol was shown to significantly improve flow-mediated vasodilation by 33%, whereas this figure slightly decreased with placebo. Thus, taking pycnogenol as an adjunct to standard medication for cardiovascular disease helps to restore body-owned regulatory mechanisms to improve vascular function. Pycnogenol normalizes high blood pressure. In most cases, an elevated blood pressure coincides with a compromised endothelial function. The improved endothelial function with pycnogenol allows for healthier vasodilation, which in turn aids to normalize elevated blood pressure. Pycnogenol was investigated in a double-blind, placebo-controlled crossover study for patients presenting with borderline hypertension who were not yet receiving hypertensive medication. Pycnogenol supplementation over a period of 8 weeks significantly lowered systolic blood pressure as compared to placebo, and diastolic pressure was found to be lowered as well. Pycnogenol has further been tested in hypertensive patients receiving treatment with calcium channel blocker nifedipine. One group of patients received pycnogenol in addition to nifedipine, whereas the control group was administered placebo in addition to nifedipine regimen. Every 2 weeks, the individual nifedipine dosage was adjusted so that blood pressure below 130 was achieved. Almost 60% of the patients who supplemented with pycnogenol were able to cut their individual nifedipine medication dosage by half to keep their blood pressure in a healthier range. Moreover, the effect of pycnogenol was again shown to significantly improve impaired endothelial function in these individuals. Vasoconstrictory endothelium 1 was significantly lowered, whereas vasodilatory nitric oxide and prostacyclin were increased. Pycnogenol increases kidney function and CRP levels in hypertension. In hypertensive patients, progressive kidney damage is frequent. Further to lowering elevated blood pressure, kidney protective measures represent an important target in advanced hypertension management and treatment. In patients with previously untreated hypertension and early signs of kidney damage, as judged by elevated urinary albumin levels, pycnogenol was taken as an adjunct to medication with ACE inhibitor ramipril over a period of 6 months. After treatment for 6 months, patients taking ramipril alone had an average blood pressure of 123/88, while those receiving pycnogenol in addition to ramipril had an average blood pressure of 119/83. The group taking pycnogenol plus ramipril had 24 hours urinary albumin decrease from baseline 91 to 39 milligrams per day after 6 months. In the group taking only ramipril, the urinary albumin decreased from 87 to 64 milligrams per day. The major improvement of kidney function with pycnogenol was shown to coincide with better kidney cortical blood flow velocity, which increased significantly compared to the group taking ramipril only. The cardiovascular risk factor, CRP, decreased significantly with pycnogenol from initial 2.2 to 1.1 megagrams per deciliter after 6 months, while ramipril non-significantly lowered the inflammatory marker from 2.1 to only 1.8 milligrams per deciliter. Pycnogenol improves blood pressure and kidney function in diabetes as well as metabolic syndrome. One of the major characteristics of metabolic syndrome is hypertension. Pycnogenol taken by patients affected by metabolic syndrome criteria, such as obesity, hypertension, elevated blood sugar, and high cholesterol for 6 months, showed significant improvement of most parameters. Compared to a control group medicated with ACE inhibitor lisinopril only, patients taking pycnogenol in addition to lisinopril achieved a significantly healthier blood pressure, hemoglobin level, body mass index, and also better total blood cholesterol and high-density lipoprotein values. Kidney function was significantly improved as judged from lowered 24-hour urinary albumin, as well as better kidney cortical blood flow velocity. In a double-blind placebo-controlled study with type 2 diabetic patients medicated with ACE inhibitor lisinopril and hypoglycemic medication, pycnogenol significantly lowered blood pressure, and half of the patients were able to lower their individual hypertensive medication dosage. Improved endothelial function was identified by significantly lowered levels of vasoconstrictory endothelin-1 in serum of patients. Urinary albumin values were significantly lowered with pycnogenol, while only marginal effects were found from placebo. Pycnogenol was shown to significantly improve blood sugar as compared to the placebo group. Elevated blood glucose represents another serious threat to cardiovascular health, and pycnogenol was shown effective for normalizing blood glucose in several clinical trials. This effect was found to result from inhibition of duodenal glucosinase. For more information on pycnogenol for blood glucose lowering, diabetes, and metabolic syndrome, please consider going to the website and looking through the diabetes care. In summary, pycnogenol is helpful on its own for normalizing borderline hypertension, and also beneficial when taken as an adjunct to standard hypertensive medication. In the latter cases, pycnogenol further improves blood pressure and allows for modifying medication dosage and improves endothelial function. On screen is an overview of clinical studies with pycnogenol showing blood pressure benefits. Pycnogenol is safe for individuals with low pressure. In an investigation of people with low blood pressure and hypotension, a daily intake of 100 milligrams pycnogenol over a period of 30 days did not significantly lower diastolic and systolic blood pressure. None of the patients experienced an unfavorable side effect during intake of pycnogenol. Pycnogenol normalizes blood platelet activity. Whereas hypertension, atherosclerosis, and diabetes contribute to progressive damage of blood vessel walls, the acute problems occurring during heart attack and stroke result from aggregation of blood platelets. An impaired endothelial function and decreased availability of nitric oxide leads to an increased platelet activity. Situations involving impaired endothelial function, hypercoagulability, and altered hemodynamics such as stasis promote the development of platelet aggregates and thrombosis. The resulting thrombus may cause clogging of blood vessels or embolism and subsequently interrupt the blood flow to certain areas of the body. This may be life-threatening when a blood clot obstructs arteries of the lung, disabling vital oxygen uptake. This is called a pulmonary embolism. When arteries supporting heart muscle, the coronary arteries, are affected, oxygen supply is interrupted, causing myocardial infarction, or commonly known as heart attack. By virtue of increasing the production of endothelial nitric oxide, pycnogenol significantly lowers the activity of blood platelets. Nitric oxide represents the natural body-owned messenger molecule for releasing elevated thrombocyte activity. Pycnogenol was shown to dose-dependently lower platelet activity in individuals typically presenting with increased platelet aggregation, cigarette smokers. Blood was drawn before and 2 hours after administration of a single pycnogenol dose. The results clearly showed a dose-dependent reduction of platelet activity. Already the lowest dose of 25 milligrams pycnogenol notably lowered the blood platelet activity. Further research revealed that pycnogenol inhibits release of thromboxane from platelets of cigarette smokers to levels of healthy non-smokers. Pycnogenol was shown to be as effective for controlling platelet activity as aspirin in these experiments. Moreover, pycnogenol was found not to increase bleeding time, an effect which is well known in case of aspirin, which significantly prolongs bleeding. The use of pycnogenol for regulation of platelet function is patented. Pycnogenol was tested in a group of 200 individuals at risk of developing thrombosis. Subjects were remaining in sedentary position for prolonged time during long-haul travel exceeding 8 hours. These conditions were known to cause pooling of venous blood in the legs, involving blood stasis, which contributes to the development of thrombosis. The results showed 5 incidents of transitional thrombosis, in total 97 subjects, which is 5.15% of the placebo group. In contrast, none of the 101 high-risk subjects in the pycnogenol treated group developed thrombosis during the long-haul flight. My correction, the statistics there were in the placebo group. The frequency was 5.51% to the pycnogenol group of 0%. Pycnogenol also improves blood lipid profile. To date, pycnogenol was found in 5 controlled clinical trials to lower low-density lipoprotein cholesterol and increase high-density lipoprotein. A significantly improved blood lipid profile was initially discovered in young, healthy subjects. Supplementation with pycnogenol for 6 weeks significantly increased high-density lipoprotein and lowered low-density lipoprotein cholesterol. A follow-up measurement 4 weeks after discontinuation of pycnogenol showed that LDL returned to baseline values, whereas HDL largely remained unchanged. Blood triglyceride levels were unaffected. A substantial improvement of blood lipids was discovered in a study with patients treated with pycnogenol. For various insufficiency, these patients presented with serious dyslipidemia with total cholesterol at 264 milligrams per deciliter, LDL at 169 megaliters per deciliter, and HDL at 46 megaliters per deciliter. After taking pycnogenol for only 4 weeks, blood lipids decreased to 212, 147, and 51 megagrams per deciliter, for total HDL and LDL cholesterol, respectively. In men with mild hypercholesterolemia, supplementation with Pycnogenol over a period of 3 months statistically significantly lowered both total cholesterol and LDL by 9.4% and 16%. HDL increased by 5.5% during this time. And a large-scale, double-blind, placebo-controlled clinical trial with 200 perimenopausal women showed a significant decrease of LDL by 9.9% as compared to baseline, as well as ineffective placebo. HDL cholesterol increased significantly by 4.6% during the 6-month treatment period. No effect on total triglycerides was found, and the results are on screen there. A study with type 2 diabetes patients found a significant reduction by 12% of LDL cholesterol from baseline, 106.4 megagrams per deciliter to 93.7 megagrams per deciliter after 3-month treatment with Pycnogenol. HDL values were not investigated in this trial. Thus, Pycnogenol significantly improves the atherosclerotic index and thus contributes to protection from atherogenesis. So in conclusion, Pycnogenol offers a nutritional approach to safeguard the cardiovascular system from 5 major risk factors simultaneously, those being blood pressure, platelet activity, inflammation, glucose levels, and lipid levels in the blood. Here is a full reference list that were used in the studies that were discussed today. Thank you for listening. If you would like to download this research, the link will be in the description.